Smart Care. Sustainable health for the future.
It may not look like it on a busy weekday morning here in Athens, but Greece is in crisis. The country is facing crippling debts, high unemployment and daily influx of migrants, all of which impacts the healthcare sector. Later, I'm talking to the health minister about his plans. But first, let's meet those on the front line, patients and doctors.
At Athens' Yenemata Hospital, we met up with pathologist Dr. Martina Pagoni and patient group activist Christos Thalamilas.
Στην Ελλάδα τα πράγματα είναι λίγο δύσκολα.
Things in Greece are a bit difficult. There's a big lack of nursing and medical staff, so there should be new recruitment and there will have to be funding directed to hospitals so that we can have medical materials, because up until now we've been on the limit with that.
Christo, tell me about what's your experience as a patient?
Lack of time is a huge problem, and that leads to people with chronic diseases not having their usual regular appointments during an appropriate time frame, but up to 9 and 10 months late.
Against that backdrop, the government has been dealing with yet another problem. It just passed a law giving free public health care to the 24% of Greeks registered unemployed and without health insurance. Critics say the change could encourage black market employment, but the health minister told us it's a matter of principle.
Medical care is a right that we, as a modern, well-governed state, should provide equally to everyone, regardless of their insurance, working or income status.
Σε όλους, ανεξάρτητα από την ασφαλιστική τους κατάσταση, την εργασιακή τους κατάσταση ή και την εισοδηματική τους κατάσταση.
So in that sense, and we very much insist on that, I believe that with this legislation, we will not empower black market labor and tax contribution evasion.
But with many more people now covered, can Greece afford this?
We believe that we fulfill the financial conditions to slowly stabilize the functioning of the healthcare system, to upgrade its services, and to cope with the extra expenditures that will arise after this legislation.
Do the government reforms go far enough, or are they just working around the edges of a system that needs much more fundamental reform? I'm off to go and get an expert second opinion.
One health analyst, Professor Kyriakos Soliotis, told us that he thinks Greece should stop taking employer-employee contributions towards healthcare altogether.
We know that we need a massive change to the system, but it seems like they try to just manage everyday reality of the system. I think that we should switch to a system based on taxation, like for example in the UK or in Scandinavian countries, because this way we buy certainty for universal coverage.
Back at the hospital, the message from those who rely on Greek healthcare every day is that whatever the funding system, more investment is needed.
What the government should do in our country is to be able to support hospitals, to give the necessary financial support. It's always about the money. The lack of specialized medical and nursing staff is what will lead the whole system, and especially our country's hospitals, to sink.
It's estimated that a systemic reform of Greek healthcare would take 5 years to implement and cost 6% of GDP.
Smart Care, in partnership with AbbVie.